A lot of people. I love being in there. I hate that I can't. But I do the best I can.
Nurses talking about how they're not able to spend as much time with their patients because they're seeing more patients than ever before. Good evening and thanks so much for choosing KLBK News. I'm Terry Furman. Covenant Health holding that press conference this morning kind of to let people share their experiences about what it's like working this pandemic, especially in the healthcare field. KLBK's Alyssa Tejas joining us now. Alyssa, this had to be an emotional day for them.
Yeah, Terry, they just went into really what their day looks like in dealing with the patients they've lost, but they're really just exhausted and they're pleading with people of Lubbock to take this seriously.
To his 5 grandchildren, all boys, Shirley Stevens was known as Pawpaw. At 85 years old, Shirley didn't know how to take it easy.
The folks they've come to know.
He was Dawson County's first COVID-positive patient and first death.
Being on the front lines of a pandemic, caring for the sickest of the sick. They've been there since the beginning, working long shifts with few breaks, now seeing the worst of it all.
We used to take care of critically ill people for days. We take care of these people for weeks. This is why our hospital's full.
With our hospitals reaching capacity, our healthcare workers are feeling its effects.
Just like all the floors, we're stretched super thin with all of our resources.
Putting on piles of PPE and spending hours with their patients. It's no easy feat.
From work and you just are mentally exhausted, emotionally exhausted.
Because after weeks, they've become attached to the ones they care for and the families they've never met.
You get very close to them and you cry when they pass and you celebrate when they get to go home.
Doing the very best they can, but there's still only so much they can do.
We can create thousands of beds in the hospital. If there's no one to take care of them, what is the point in having a bed?
So while the virus may have a 2 to 3% mortality rate, there is so much more to consider, like how the virus affects the body.
Again, a lot of people focus on mortality. If you start looking at morbidity, permanent damage to the body, this only doesn't affect the lungs.
These aren't just percentages. These are actual humans that we are trying to help.
So while they try to work through the most difficult of days, they know that while it may be tiring to continue to follow guidelines for so long, this is our new normal and they are exhausted.
People that continue to live their normal lives without any care for their neighbor or anyone else around them is just disrespectful to the medical community.
We're just ready for it to, dwindle down and everybody, do their part so we can beat this thing.
Wow. And Terry, one of the things that they mentioned was how you can thank them. So of course at the beginning of the virus,
there were so many people. Like they had food all the time. They were full on food.
Food, gifts, all that. And they said that while that was nice and they would appreciate that, the main way that you can help show your appreciation for these people is just giving them a simple thank you. They said that will go a long way.